specialize in physical medicine and rehabilitation, so I'm a physiatrist. And I have 3 kids who are somewhat interested in healthcare. It depends on which one you ask, but they all have different interesting things that they're doing. And I am on the faculty at Harvard Medical School. I'm an associate professor in the Department of Physical Medicine and Rehabilitation. I'm also in charge of strategic initiatives for my department at Harvard Medical School and for Spaulding Rehabilitation Hospital. And one of the most interesting and exciting things about being in charge of strategic initiatives is that I get to really help my colleagues develop great innovative ideas and support them with respect to the strategy. And that's really where my sweet spot is. I love being an innovator, but innovation doesn't really get you very far unless you've got awesome strategy. And that's my sweet spot. So thanks so much for taking the time to listen to this. Well, I'm a physician, and I was really busy just being a physician, and I was in my 30s with 3 little kids, an active job, patients. I was a wife, mother, daughter, sister, doctor, all kinds of different roles, and I was diagnosed with cancer, and everything just came to a complete halt. And I felt really good going into treatment, and as I went through treatment, I got really, really sick. In fact, when I was done with treatment, I was sicker than I had ever imagined. And I realized that there was something missing from the healthcare continuum, from the medical care continuum, and that's really rehab. So, for example, I treat people who have ankle sprains, and they get more rehab than someone who's had surgery and chemotherapy and radiation treatment and so on. And that was a really big disconnect because I had to heal myself. My oncologist said after my last chemotherapy treatment, go home and try to heal yourself, and someday go back to work if you can. And that was pretty devastating. So as I worked on healing myself, I said to myself, I'm going to change this. I'm going to really make a difference and help survivors heal better and faster with cancer rehabilitation so that they can resume their lives, so they can take care of their kids and they can go back to work and they can be a productive member of society. And that's really where the idea for Oncology Rehab Partners and the STAR program certification came from. Such an important thing to think about is how do you take a great idea and actually develop that idea, and then after you've developed it, get it out to the world. So there's really 3 different components. There's the innovation part where you basically say I'm gonna come up with an idea and I'm really going to innovate, and then you've got to develop that sort of beyond innovation. You have to really develop that idea. And then, if you've done those first 2 steps really well, then you have to get the word out there. So winning awards is really not about just winning awards. It's about everything that you did in steps 1 and 2. And the awards part comes in when people recognize your work. And they don't necessarily just recognize it automatically. A lot of times you're working with PR firms, or you're working with other media professionals and so on to let the public know or key stakeholders know more about specifically what you're doing. Being a really terrific communicator is incredibly important in your career, and that can mean that you speak well, it can mean that you write well, it means that you know how to use social media well. You don't have to be perfect and you don't have to know it all, but using different ways to communicate and coming at it from different ways is incredibly helpful. One of the things that I talk to the people that I direct in the course and that come to the courses that I teach is to think about, for example, an iconic image. How can you create an iconic image that would immediately get the idea about your innovation or your service across to people? That's a really hard thing to do, but it's great practice for getting across a message very quickly to audiences. I think one of the biggest challenges in the healthcare industry to innovation is to really pair doctors and other healthcare innovators who understand the key gaps in care, the key things that will really drive healthcare forward, with the people who know how to make that happen. So it's really a collaboration between business professionals and physicians and others. And that's a big challenge. Traditionally, healthcare professionals, especially doctors, have been worried about working too closely with business, especially pharmaceutical industry and so on, that has had problems in the past with relationships. My own ideas about innovation have evolved over time. I remember I was sitting and talking to a venture capitalist, and he said to me, you know, the biggest bottleneck is that there aren't enough innovators. And I thought about that a lot, and I thought about all these creative ideas I have, and then I became the chair of strategic initiatives for my department, and I realized that in my department there's all these people with fantastic ideas. They're innovators, but they actually are great at the idea generation part, but they're not as skilled at the idea development part of things. And that is, I think, the biggest bottleneck, is that there's a lot of great ideas running around out there. There's a lot of great ideas that people are constantly saying, we should do this, and we should do that, and this would be really great if we had this. Taking that idea to the next level, and then 1,000 other levels, strategically, step by step, is where people really get stuck. And they drain a lot of resources and so on. So I think that idea development engine is really important. There's really 3 steps. There's that idea development culture you want to build. Then there's the engine you have to build to develop those ideas. And then there's the getting the word out about those ideas part.